You know, most of us think of polio as a disease of the past, right? A battle we won decades ago, all thanks to vaccines. But what's incredible is that for millions of survivors, that battle isn't really over. There's this mysterious and really challenging condition that can show up decades later, kind of like an echo of the original illness. So today, let's explore this lingering shadow of a supposedly conquered disease, post-polio syndrome. So, here's our roadmap for this explainer. We're going to start by looking back at polio itself just to get the foundation. Then we'll get into what post-polio syndrome actually is. After that, we'll dive into the fascinating science of why it even happens. Then we'll cover the practical side, how people manage it, and finally, how to navigate the healthcare system to get the right support.
All right, so to really get a handle on these late effects, we have to start with a quick refresher on the original disease itself. So acute poliomyelitis. It's a viral illness that, in some folks, makes its way into the central nervous system. And it's picky. It has a very specific target, these nerve cells called anterior horn cells. Think of these as the command centers in your spinal cord that fire off the signals telling your muscles to move. When the poliovirus damages or just flat out destroys these cells, that connection is cut, and that's what leads to the muscle weakness and paralysis that we all associate with polio. This timeline really maps out the entire journey for a polio survivor. It all starts with that sudden, acute infection. But what follows is this pretty remarkable period of recovery, which can actually go on for years. Then you hit this long, long phase. We're talking 15 years, sometimes much more, of stability. Life feels, normal. But it's after that long, quiet period that these brand new, progressive symptoms of post-polio syndrome can start to creep in.
Okay. So what exactly is this condition that shows up so many years down the road? Let's break down the official definition.
And get this number. It's just staggering. An estimated 40%. That's nearly half of all polio survivors who might eventually have to face this second wave of the disease. This isn't some rare, fluky thing. It's a very real part of life for a huge community of people who thought their fight with polio was ancient history.
Now, diagnosing post-polio syndrome isn't just a guess. The criteria are super specific. First, a doctor has to confirm you actually had polio. Then, there has to have been that recovery period and at least 15 years of things being stable. After that, 2 or more new symptoms like major fatigue or new weakness have to appear. And this last one is so important, it's what's called a diagnosis of exclusion. That means doctors have to rule out every other possible medical reason for these new symptoms before they can say, yes, this is post-polio syndrome.
So this brings us to the big question, right? Why? Why does the body, after recovering so well and being stable for so long, suddenly start to experience this new weakness? Well, the answer is actually hidden in the incredible way the body compensated in the first place. So back during that recovery phase, the motor neurons that survived the polio attack basically went into overdrive. They started sending out these tiny new nerve fibers to connect with all the muscle fibers that were left orphaned when their original nerve cells died. This whole process creates these things called giant motor units, and it's exactly what it sounds like. A single nerve cell is now doing the job of many, controlling way more muscle fibers than it was ever designed to handle.
And right here, this is the long-term price of that amazing compensation. This quote really gets to the heart of it. Those super hardworking new connections, they just can't keep up that pace forever. After decades of being under this huge metabolic strain, they start to wear out and break down. And as they fail, those muscle fibers get disconnected all over again, which leads directly to that new, progressive weakness that defines post-polio syndrome.
This analogy is just perfect. It really makes it click, doesn't it? The nervous system pulled off this heroic repair job, but that repair was put under this immense, lifelong stress. Post-polio syndrome is basically the point where that overworked system, after running in the red for decades, finally starts to show the strain.
Okay, so understanding the why is one thing, but actually living with the day-to-day effects is something else entirely. So how do you manage this condition? Let's look at the strategies for living with post-polio syndrome.
Managing this is a constant balancing act. It's like walking a tightrope. If someone with post-polio syndrome pushes their already strained muscles too hard, they risk doing more damage. That's overuse. But on the flip side, if they don't use their muscles enough, they'll get weaker just from deconditioning. That's disuse. Finding that sweet spot right in the middle is absolutely everything.
So how do you find that balance? Well, it comes down to a strategy called energy conservation. Basically, it means pacing yourself, mixing periods of activity with planned rest. It means modifying tasks,
finding easier ways to do things to reduce strain. And it means using assistive devices, like a cane or even a scooter. The whole goal is to save the energy and strength of those fragile motor units for the things that matter most. And it doesn't stop with energy conservation. Other techniques are also super important. Gentle, non-fatiguing exercise can help maintain strength in the muscles that are still healthy. Stretching is great for improving body mechanics and reducing strain. And a lot of people find warm water therapy to be a game changer. The water supports your body, so you can exercise gently without putting a ton of stress on your joints and muscles.
Because post-polio syndrome can affect so many different parts of the body, and let's be honest, it's often misunderstood, getting the right care requires a really specific and coordinated game plan.
Yeah, managing this is definitely not a one-person job. The best care comes from a whole team. This is usually led by a physiatrist. That's a doctor who specializes in physical medicine and rehab. They work alongside physical and occupational therapists for exercise and daily living strategies, an orthotist for any braces you might need, and maybe even a pulmonologist if breathing muscles are affected. It's all about teamwork.
Now, this is a really, really critical question. Any kind of surgery, even if it seems minor, brings a whole unique set of risks for a polio survivor, especially when it comes to anesthesia and recovery.
The recommendations for surgery are crystal clear and so important. If you can, go to a major university hospital. They just have more specialized resources. It is absolutely vital that the surgeon and the anesthesiologist talk to each other before the procedure about the patient's polio history, because anesthesia can be really risky for muscles, including the ones we use to breathe. That's why a full breathing evaluation beforehand is a must. The team also has to plan around any skeletal issues like scoliosis to make sure positioning during surgery is safe.
So here's the big takeaway from all this. Post-polio syndrome isn't some footnote in a medical textbook. It is a living, breathing reality for millions of people. And as this huge generation of survivors gets older, our focus really needs to shift. We have to move from just celebrating the past victory over a virus to facing the present challenge of providing real understanding, support, and informed care for the long journey that comes after. Which leaves us with a pretty important question, doesn't it? How can we all do a better job of recognizing and addressing the lifelong echo of this supposedly conquered disease?